The 23andMe survey of over 1,000 people ranked low-dose naltrexone as the #1 most helpful product for fibromyalgia. A double-blind placebo-controlled trial at Stanford showed that low-dose naltrexone resulted in pain reduction and improved quality of life. What is low-dose naltrexone and why is it so effective? In this video, we'll review how low-dose naltrexone works, why it's so effective, and the data supporting its effectiveness, and why you have probably never heard of it. But first, what is fibromyalgia? Muscular pain, fatigue, insomnia, and headaches. These are just some of the symptoms of fibromyalgia, a chronic pain disorder that affects at least 5 million Americans. The disorder is incompletely understood, although it is thought that it is caused by hypersensitivity to pain. Pain signaling is mediated in the brain through opioid receptors or neurons. When exogenous opioids, such as morphine, act on these receptors, it reduces pain signaling. However, morphine is not an effective treatment option due to side effects and risk of opioid addiction. Safer strategies to alleviate the symptoms of fibromyalgia are needed. Low-dose naltrexone, LDN, may be the solution. Naltrexone has been approved by the FDA for over 30 years. A typical dose of 50 mg or more per day inhibits opioid receptors. In simple terms, that means it prevents the body from recognizing opioids. What clinicians have discovered is that, in small doses, around 1/10 or less of the conventional 50 mg per day dose, naltrexone impacts the body in other ways that can be beneficial for those suffering from fibromyalgia or other autoimmune inflammatory conditions. Here's what the science says. There are immune cells in the brain called microglia. Microglia look for inflammation and help protect the brain from damage. They usually remain dormant until triggered for action. Once activated, these microglial cells release cytokines that make us feel sick. Think about if you get the flu. You likely feel horrible and sick. That's your immune system forcing you to stay in bed so that your body can allocate all the resources to fighting off the infection. In some people, these microglia have become chronically activated, and they release inflammatory chemicals which irritate the nerve cells around them, causing them to become hypersensitized to pain. This causes chronic inflammation, chronic pain, and fatigue. One theory why LDN is effective is that it acts as an anti-inflammatory for the central nervous system. It acts on specific receptors on the microglial cells that, in simple terms, calms them down and reduces the release of pro-inflammatory cytokines. This allows the nerve cells to normalize the volume of pain signals and may serve as a therapeutic mechanism to alleviate the cause and symptoms of fibromyalgia. Another scientific theory supporting LDN's effectiveness surrounds its ability to modulate the immune system and lower chronic inflammation, which is what many medical theories believe to be the cause of fibromyalgia and many other autoimmune conditions. LDN works to block opioid receptors in the brain for only several hours, instead of the conventional dose, which blocks receptors for 24 hours. This shorter duration stimulates the body to naturally produce more endogenous opioids, such as methenchyfalin. Numerous studies have shown that methenchyfalin displays the capacity to stimulate an immune response, having a positive effect on various different types of immune cells, which in turn can improve resistance to tumour growth, bacterial and/or viral infections. In addition, LDN was shown to reduce chronic inflammation by reducing various pro-inflammatory cytokines. So to summarise, the pharmacological impact of naltrexone seems to be dose-dependent. While at high doses, 50 mg per day, naltrexone is effective at inhibiting the opioid receptors, at low doses, 3 to 5 mg per day, it has different effects such as inhibition of microglia activity. But does LDN actually help patients? Well, LDN was reported in a 23andMe study of more than 1,000 patients suffering from fibromyalgia to be more effective than 100 other different treatments. More importantly, LDN has been tested in 2 published clinical trials. The more recent trial was larger and involved a randomized, double-blind, placebo-controlled crossover design. In this trial, a 4.5 mg dose of LDN was given for 12 weeks. A greater reduction of baseline pain was seen in patients taking LDN compared to placebo, in addition to improved mood and general satisfaction in life. Moreover, these trials validated the safety and tolerability of LDN, which has been prescribed for different conditions for over 40 years. The only main reported side effects seen in the trials were increased vivid dreams and headaches. The reduction in daily pain seen in these trials supports the current consensus for the action of LDN. 1. Reducing microglia activity. 2. With a reduction of this microglia activation, this can lower inflammation in the brain. And thirdly, a reduction in inflammation negates pain hypersensitivity. Whilst research is still being conducted to further understand the action of LDN and the underlying causes of fibromyalgia, the current pharmacological data shows LDN is a safe and well-tolerated drug that has reduced pain in many fibromyalgia patients. So, why have you not heard about LDN before? The reason is that because it's a generic drug, and none of the pharma companies are incentivized to spend resources on clinical trials and education for drugs that are generic, they don't stand to make a return on their investment. If you're suffering with symptoms of fibromyalgia, get in touch with Ageless RX today to see if LDN is right for you.